Hi, Kevin Henry, the Group Editorial Director for UBM Medica's Dental Division, and we're here on a Google Hangout this evening with our good friend, our technology editor, and our chief dental editor, Dr. John Flucke. Hey, John, what's going on tonight?
Hey, Kevin, how are you? It's good to hear from you.
Man, it's good to talk to you too. And I know you've got some big things coming up, including a talk at a very cool event that's coming to Chicago the first part of August. And that's going to be the Dental 3D University that's hosted by the Cavo Kerr Group Imaging Brands, October 1st through the 2nd at the Hilton Chicago. And you, John, are going to be talking about endo and 3D and kind of the relationship between that.
Right.
So, you know, you and I talked a little bit before we got started, and it really is one of those things that, tell me how endo, after all these years of being done, how it's kind of now had that game-changing experience with 3D becoming so popular and mainstream now.
Sure. You know, it's interesting, Kevin, because there's the old, adage everybody's heard about, you don't know what you don't know. And I routinely tell people that when it comes to 3D, I agree with you don't know what you don't know, but the other part of it is you don't know what you don't see. And it's a game changer because, once you can literally pick something up and turn it around and see it from all directions, whether it just be a difficult case when you're starting, or a retreat or anything like that, when you're trying to figure out, there's some strange problem with a tooth and you're trying to figure out, is it a cracked root or what's going on? It just gives you so much more information. And I've got a little prop here to kind of help illustrate that. This is actually an acrylic block, and hopefully I'm going to lower it a little bit so you can kind of see it better against my shirt. But this is a block that most dentists that do endo or have been trained on endo have seen things like this before. But this is actually a block where the tooth was scanned 3D, and they identified the pulp chamber. And then through the magic of technology, they literally printed this acrylic block. And that is the actual pulp chamber from a real live tooth. So it gives you, when you're practicing your technique, it gives you a much better, feel and representation of what is really going on. And so just like I was turning that block, if you can imagine, before you start to do a case, being able to pick up the tooth and then rotate it 360 degrees or sideways, or take it apart in little tiny pieces, piece by piece, you glean so much more information from that before you start. And I think that dentists, we've managed to do really well with our treatment of endo because we're so well trained, and because we take all these classes in morphology and all that sort of thing. And so you learn, mentally to extrapolate what you see 2D into 3D, but you still there's a certain amount of guesswork. You're still guessing, because you can't see everything. Once you got 3D, you see it all.
Well, and that kind of leads into the next question I was going to ask you. Obviously, you are a tech guy. I mean, that's why you're our technology editor, and we're glad to have you as that, trust me. But, I know a lot of your peers who don't have this kind of technology and who don't practice dentistry in maybe the most tech-savvy practice. Can you imagine transporting yourself into that situation and having to work like that now that you have all this at your fingertips?
No, absolutely not. I can't go back. It's sort of one of those things with technology. I think we can all deal with this analogy, which is, sometimes you'll be under the weather, and, whether you've got a cold or maybe you're starting to run a fever or whatever. We've all done things where it's like, dang, I'm not feeling real good today. But, I can push it. I can, get through my day. And it doesn't matter, whether you're doing dentistry or working for a magazine or whatever. And we all, kind of take one for the team and do what we got to do to get the job done. But then, in a day or two, when you feel better, sometimes you'll look back and go, wow, I had no idea how poorly I felt, until I felt good. And it's the same way for me with a lot of the tech tools that I use, including 3D, which is that knowing what I know now and the knowledge that I glean from that and there's no way that I could go back. And you know, it used to be, you know, years and years and years. I mean, literally decades ago, the only way that dentists had to prepare a tooth was with a slow speed or a belt driven. You know, would you go back to that? Absolutely not. You know, once you get better tech, you never want to go back. And that's the way it is with this. There's so much more information. You can provide such a better service to the patient that you owe it to your patient to use the best tools available.
That's great, John. I mean, and obviously, you know, I know that that's something that you preach all the time, the fact that technology is something that really, you owe to your patients. I mean, it's very well said.
Thank you, Kevin. And I really do feel that way. It's, you know, at the end of the day, and I know you and I have had this conversation multiple times, but at the end of the day, I don't care if you are, you know, a dental supplier, a dental manufacturer, someone that, you know, writes for a publication or whatever. At the end of the day, everybody's boss is the patient. And, you know, and that's our target, and that's what we owe them our best to. You know, nobody goes in to the, you know, a situation where they're dealing with a patient and go, you know, I'm going to mail it in. I'm only going to do 50% of my best today. You know, we all do our best, and they deserve that. That's what we owe them.
Well, John, again, is going to be one of the featured speakers at Dental 3D University in Chicago, October 1st and 2nd. This is from the Cavo Kerr Group Imaging Brands. It's going to be a very fascinating couple of days, I have a feeling, John. And again, you're speaking on endo and 3D, and certainly I'm looking forward to hearing more about it.
Thanks, Kevin. I am really looking forward to this. I love Chicago, and I love to teach. And the, you know, the people that they've got at this event and the format, the way they have it set up, I'm really, really honored with the way you know, that they've done this, and I'm honored to be part of it. Hats off to the Cavo Kerr Group. I am really looking forward to this event.
Sounds good, John. Well, we'll chat with you on our next hangout. Thanks for the time tonight. I appreciate it.
Hey, anytime, Kevin. It's always great talking to you. Have a great evening. Thank you.